From the studios of Tucson Business RadioX, recorded in the Stewart Title corporate offices on Broadway, you are now listening to The Mark Bishop Show. And now here's your host, Mark Bishop.
And welcome to another show. You know, you can shop for your 2021 healthcare plan from the safety of your own home. Now, I have an expert with us today who give us tips on navigating the Medicare annual election period during a pandemic and getting the most out of your plan. I'd like to welcome Shannon Adams, Medicare Advantage expert and head of customer experience at Cigna. Hi, Shannon.
Hi, thanks so much for having me.
You're most welcome. Now, what is the Medicare annual enrollment period, please, Shannon?
Sure. So the annual enrollment period is a time for folks that are 65 and older to make a choice about their Medicare Advantage plan for the new year. This period runs from October 15th, so now, and runs through December 7th, which is just a short period of time to make your decision.
So in what ways is Medicare Advantage different from the original Medicare coverage?
Medicare Advantage plans are very popular. More than a third of American seniors are enrolled in a Medicare Advantage plan. And they're so popular because they provide extra benefits that traditional Medicare doesn't offer. Things like dental, vision, hearing, and transportation. These are great options for seniors to have, which makes Medicare Advantage a really popular product.
Well, Shannon, what I'd like to do is perhaps give you some headings on some tips for our listeners, and, you take it away with each one. I mean, for instance, if you were to go online, what would they do?
Sure. So you can start out going to Medicare's Plan Finder. That's a great way to see all of the plans that are available in your area. Folks can also attend a virtual education session. So historically, this was done in person. Now these are done virtually, which is a great way to connect with a broker or with a health plan to better understand your options.
Okay, now that's the Medicare.gov, is that right?
Yes, Medicare.gov, and there's a plan finder in there that folks can enter their zip code or county and get personalized information to them with plans that are available.
Oh, that's fabulous. All right, let's look at another one. Say I was to say, just pick up the phone.
Yes, so you can call, if you're currently enrolled in a Medicare Advantage plan, you can call your plan and ask any questions about what's changing for the new year. All Medicare Advantage plans have sent what's called an annual notice of change, and that will tell you specifically what things are changing in the new year. So it's always great to pick up the phone and make sure that you understand your options. You can also call an independent broker, someone who can sell multiple plans, and ask him or her questions that you have, and they can help walk you through all the different types of options. As you're searching, you really want to make sure that your Medicare Advantage plan has your doctor and hospital in network. And you also want to make sure that your medications are covered. Those two things are important for Medicare Advantage.
Now, you need to review changes as well, right, with ANOC. That's the annual notice of change.
Yes, exactly. So that's already mailed. It should be in customers' homes already. This is a document that will tell them everything that's changed. And one of the great things about Medicare Advantage plans is often each year the plans get better. There are more things that they are covering, more of those extra benefits. So you'll always want to make sure that you are taking advantage of everything that is available to you.
Well, that was my next heading, with the weighing of extras, paying attention to extra benefits that are not available in the original Medicare, but may be built into an MA plan. Now, this includes, if I'm right, dental, vision, transportation, or telehealth visits. Is that correct, Shannon?
Yes. And so you want to think through which types of benefits you are likely to use next year. So if you need glasses or contacts, find a plan that has great vision benefits. You mentioned telehealth. This is becoming just a great option for seniors, especially those who can't or are unable to leave their home. They can still have a medical appointment with their provider, either over the phone, or if they've got a smart device, they can do it over video and get all of those preventive health screenings that they need. They can actually do their annual wellness exam over telehealth, which is just a great option.
Yeah, well, one of the things that my listeners have got to consider are the costs, right? Know the plan's premium or the monthly cost.
Yes. And one of the great things about Medicare Advantage plans is that many have no additional premiums on top of what you would typically pay for your traditional Medicare premium. So every plan is different, but the majority of them do have a $0 premium option. You'll also want to look at different costs that could be charged throughout the year. Co-pays are something that you could pay when you see a PCP, your primary care physician, or a specialist. Now, some plans actually have $0 doctor coverage. So, meaning if you go see a specialist, you won't even have to pay a copay there, which can help you save even more money. So you want to make sure that you look up those costs for each individual plan and find one that fits your budget and your healthcare needs.
Well, you need to check to, your favorite facilities and that the doctors are in the network that you choose. And what about prevention? Talking to your doctor about necessary screenings and vaccinations.
Yes. So this is so important to stay healthy now, especially during the pandemic. And one of the best ways that you can do this is get your screenings and get those flu shots and vaccines, all of those things that keep you healthy. Medicare Advantage plans cover these screenings, and actually some give incentives for their customers to do them. So if you go get that annual wellness exam, even over telehealth, if you do that, you can get a gift card or different incentives for choosing the right path and taking care of your healthcare needs.
Well, safety is first. I guess if you do need to do a face-to-face meeting, you've got to be sure to follow all the proper COVID-19 safety precautions as outlined by the CDC. Has COVID-19 changed the priorities of what to look for in a health plan, do you think, Shannon?
I think so. I think it's really shown that healthcare is one of the most important investments that you can ever make. And now, especially as the pandemic continues, it's just so important to have comprehensive health coverage, something that covers anything that could happen, and something that gives you peace of mind during a really challenging time. I think it also has helped us evolve the way that we take care of customers, especially with telehealth, since this is just a great way to stay on top of all your healthcare needs and still be at home.
Well, there's a fair bit of information for people. There's nothing better than sitting there with a hot coffee or hot tea in your pajamas and your podgies looking at a website. And this particular one is Cigna.com /Medicare. That's www.Cigna.com /Medicare. And I guess everything's on that site there, Shannon, for them to read.
Yes, exactly. Your users can go in, enter their zip code or county, and everything will be personalized for them of what's available in their area.
That's fabulous. Well, you're the head of customer experience for Cigna Medicare. More than 15 years of experience in analytics and healthcare focused on making things just that little bit easier and more efficient for customers. So thank you for your time today. It's a very important time. 15th, we'll date this podcast, but it's the 15th today. That's out of the gates. Go get this covered. Get it done. Right, Shannon?
Exactly. Don't delay.
Thank you so much. We appreciate that. That's Shannon Adams, ladies and gentlemen, holding a bachelor's degree from Western Kentucky University and a master's degree from Vanderbilt University. She does a great job for Cigna. So, look, today's the day. It's the start. Go get it all done, and you'll feel a lot better and a lot easier. I'll be back with another show soon.